Greetings, we are Team Prakram and we are here to present a robust solution to a critical issue faced by hospitals, that is, online testing and monitoring of quality of medicines and consumables. Our solution is a blockchain-powered cloud-based system for real-time quality monitoring. With blockchain, we are creating a secured, decentralized and tamper-proof system record of every log. And with cloud-based storage, we are ensuring that hospitals can access and verify supply quality instantly and flagging issues before they reach the patients. The automated section rejections are here to reject the non-conforming shipments, the low-quality medicines which were being tested and failed in the test. The AI-aided regulatory compliance will help in tracking the latest changes in regulations, continue the monitoring compliances and generating reports through reference data comparing and verifying the supplier certifications through AI. Moving on to how it addresses the problem. So the system addresses the problem by automating quality checks, offering tamper-proof test reports, providing transparency to reduce counterfeiting and generating alerts through notifications and pop-up messages at real-time monitoring whenever we are generating the compliance reports and saving the blockchain audit trails, although having the user-friendly interface which is easy to use. Now focusing on its workflow. So it will start with user. User means the person who is using this software, and the user is redirected to a login sign up page where two things will be in option. First is request and grant login credentials, यानी कि login credentials जो भी registered होगा system पे वही use करेगा. And secondly, if you are not registered, so you can register by making a new account. Both of the information is stored in the database. When these processes completed, the login sign up page, after it a AI driven dashboard will be provided over there, in which three dashboards are the main: the hospital dashboard, the administrator dashboard and the manufacturer and supplier dashboard. तो हॉस्पिटल से स्टार्ट करते हैं. हॉस्पिटल क्या करेगा, एक रेफरेंस एंड डिमांड देगा एडमिनिस्ट्रेटर को विच एवर मेडिसिन हॉस्पिटल रिक्वायर्स. एडमिनिस्ट्रेटर will give its need and quotations to different manufacturers, and all manufacturers will provide a quotation to the administrator. After it, administrator will compare the cost, will compare the time that the manufacturer is providing medicines, and will also compare which is very suitable for it to buy the medicines. Then after all this process, the administrator will final the quotation and provide it to a single manufacturer. So एडमिनिस्ट्रेटर ने यहाँ पे कोटेशन दिया, मैन्युफैक्चरर के पास गया, मैन्युफैक्चरर ने अपना कोटेशन एडमिनिस्ट्रेटर को दिया. एडमिनिस्ट्रेटर ने सारे कोटेशंस में से कॉस्ट कंपेयर और टाइम कंपेयर करके, क्वालिटी कंपेयर करके एक बेस्ट मैन्युफैक्चरर को देखा और उस बेस्ट मैन्युफैक्चरर के साथ अपना कोटेशन फाइनल करते हुए उसको ऑर्डर प्लेस किया. तो जब मैन्युफैक्चरर के पास ऑर्डर प्लेस हो जाएगा तो मैन्युफैक्चरर के पास आएगा एक सप्लायर एंगेजमेंट प्लेटफॉर्म. सप्लायर एंगेजमेंट प्लेटफॉर्म पे क्या होगा, यहाँ पे जो मैन्युफैक्चरर के सप्लायर्स होते हैं वो रजिस्टर्ड होंगे. एडिशनल सप्लायर्स कैन रजिस्टर बाय मेकिंग अ न्यू अकाउंट. सो जो सप्लायर एंगेजमेंट प्लेटफॉर्म पे सप्लायर्स रजिस्टर होंगे, तो अब जो डिलीवरी होगी ना वो सप्लायर के पास ऑर्डर पहुंच गया है. तो सप्लायर क्या करेगा, सबसे पहले यहाँ पे वो अपलोड करेगा मेडिसिन की डिटेल्स को, रियल टाइम इमेज अपलोड होगा, यहाँ पे एक चेकिंग प्रोसेस यहाँ होगी और यहाँ कंप्लायंस रिपोर्ट जनरेट होगी. तो जब यहाँ की चेकिंग प्रोसेस कंप्लीट हो जाएगी तो सप्लायर ऑर्डर को डिलीवर कर देगा. तो जब सप्लायर हॉस्पिटल को ऑर्डर डिलीवर कर रहा होगा तो उसके बीच में जहाँ जहाँ ऑर्डर जाएगा उसकी ट्रैकिंग डिटेल्स वो सारी हमें मिलेंगी. और ये जो मेडिसिन स्टेटस टाइमलाइन आप देख रहे हैं, इसका मतलब है कि मेडिसिन कहाँ पे पहुँची और कितने टाइम में हॉस्पिटल को डिलीवर हो जाएगी. तो ये जो ट्रैक डिटेल्स रहेंगी वो हॉस्पिटल, एडमिनिस्ट्रेटर, मैन्युफैक्चरर और सप्लायर, all of the persons के पास रहेंगी. So now the medicine is received in hospital. Here the order received. तो जब मेडिसिन हॉस्पिटल में आ गई है तो एक रियल टाइम इमेज अपलोड किया जाएगा वहाँ पे क्वालिटी चेक के लिए. तो क्वालिटी चेक हम करेंगे रेफरेंस डेटा के थ्रू, जो कि हमारा क्लाउड पे स्टोर्ड रहेगा. तो रेफरेंस डेटा में हम जो कंपेयर करने वाले हैं दैट इज वी आर कंपेयरिंग बैच नंबर, expiry data, packaging price, QR code and some other details also. So after this quality check and alert, the system will compile a compliance report and it will provide the details of the medicine to the user. So if the report is all good or if the report is not all good, it will be provided to administrator. If the report is all good, so administrator will now done the payment to the manufacturer. After the report generation, here is also an option for users to feedback and rate this process or rate the manufacturer and supplier. Then here it is about us and contact us to know more about us. The uniqueness of our solution is that it offers a cloud-based platform that leverages blockchain technology to ensure the quality of medicines. First point, real-time monitoring is provided over here. Secondly, you can use QR code authentication to track and travel, means to track the details of medicines wherever it is reached. Now the compliance report generations. The compliance reports will be totally updated with real time, then easy accessible management. So because it's blockchain, so it is very easy to find data and also it is less prone to risk of losing data. Means cloud based software है तो data loss होने का इतना risk नहीं रहेगा, backup option है. Then data integrity and transparency, क्योंकि blockchain है तो हाँ everyone can see the audit logs. Technologies we are using in this are React.js, JavaScript, HTML, CSS in front end. For backend, we are having Python, Express.js, Node.js, blockchain. For database, we are having Ethereum for blockchain and MySQL for reference data storage. Then libraries or APIs, whichever we are using, are Google Maps API for tracking and Google Cloud for storage. Moving further, feasibilities of the idea are that it will enhance the patient safety and financial feasibility, means it will provide the high return of interest because now the faulty medicine supplies and operational costs are now cut. So viability of the idea is that it will be doing the real-time monitoring, immediate issue detection, regulatory compliance, so no compliance risks will be provided, scalability, and it is adapted to a growing data. What are the challenges we are facing to implement this system is the data security, means we have to keep a strong encryption and security protocols. The user adoption, due to lack of familiarity with the new system, user may not adapt the system, and also the regulatory compliance in different regions. Some strategies whichever we have thought for overcoming these solution challenges are data security. For data security, we can apply the multi-factor authentication. For user adoption, we are building a easy-to-use interface, and for regulatory compliance, we are using the monitoring regulations regularly for flexibility. Then our target audience are hospitals and health systems. The impact is they will give guarantee to high medicines and consumables are reached in their hospital. Healthcare procurement management will perform the automate quality checks and they can provide the procurement efficiency too. Third, medical chain professionals. They will ensure that a reliable and consistent supply chain is being maintained between the hospital and the manufacturer. Then the pharmaceutical suppliers and manufacturers, their work is to ensure that the product is meeting the quality standards before it hits the hospital. The benefits of the solution is enhanced patient safety, reduce operational cost, and increasing trust for healthcare among public. There are some references through which we have done our research, and now I complete myself here. Thank you.